By the name of Allah, the most gracious, the most merciful, greeting to all of you and welcome to this simple lecture on varicocele. What is varicocele? And what are the different methods of treatment? And could varicocele induce male infertility? And if the answer is yes, how? I'm going to answer all of those questions and the other common questions asked to me in the urology clinic on varicocele on this simple lecture. To be able to answer all of those questions, it's better to know some basic medical concepts. So each organ in our body has artery and vein. And if we look to the testicle, this is the testicle and it has the artery by red color and the vein by the blue color. So what is the difference between the artery and the vein, and what are the differences between the blood in the arterial system and the blood in the venous system? If we take this simple example, I think the matter will be easy understood. Look to this water sink. It has a water and the drainage system. This for sure brings the fresh water, and the drainage system takes out the dirty water. Exactly the same. The artery brings the fresh blood, the blood with oxygen, the blood with nutrients, the blood with food to the organs and the tissues. And the vein takes out CO2 or carbon dioxide and waste products of the tissues. The blood in the arterial system flows easily because of the pressure inside the arterial system induced by the heart pumping. The heart is like a pump. However, the blood in the venous system has some difficulty, especially the veins below the level of the heart. As you know, the fluids comes easily from up to down, but it doesn't come, from down to up or downhill to uphill by its own. So how to solve the problem? To overcome this problem, there are certain mechanisms in the veins to overcome these issues. One of them, they are the valves, all inside the venous wall. So if we look inside the venous wall, there are valves. Those valves permit the passage of the blood in one way only, from down to up, and prevents any backflow of the blood from up to down. In case of partial dysfunction of these valves, there is some backflow of the blood from up to down. However, with complete disruption of the function of the valves, more blood comes from up to down. With accumulation of the blood inside the veins dilate and they become more tortuous. This is how, or what is the meaning of varicocele. We get advantage of this natural phenomena in manufacturing the water heater. If you look to the water heater, there is inlet for the cold water and there is outlet for the warm water. And there is a valve in the inlet of the cold water. That valve prevents the backflow of the warm water outside. This is the normal picture for the testicle and for the normal caliber of the venous system. And on this side you can see dilated tortuous veins. And this same picture shows also dilatation, tortuosity of the veins of the testicle. This is a typical varicocele. And also this is a real case from my clinic. Look to the vein. There is a dilated veins under the skin. And look to the testicle. It's down. And this is dilated tortuous vein. It's a grade 3 varicocele. How does the varicocele affect the function of the testicle? I'm going to stop a little bit here because this question is commonly asked to me in my clinic. So the testicle has two main functions. Function number one, it is the main factory and the only factory for sperms. Also, it secretes hormone named testosterone. This hormone which is responsible for the male sexual characters. This factory has a unique criteria. It works on 3 degrees below the core body temperature. If the optimum body temperature or normal body temperature is 37, this factory works on 34 degrees Celsius. and for that reason the testicles are outside the body. The testicles have a unique cooling system, and I'm going to discuss this system separately in the video of male infertility. And by the way, the testicle that exists inside the abdomen or inside the belly doesn't produce any sperms. Why? Although it exists in a normal body temperature, which is 37, but this temperature is not the optimum for this factory. Returning back to the varicocele, backflow of the blood, stagnation of the blood, stagnation, accumulation of carbon dioxide, waste products inside the testicle, and decrease the level of oxygen. All of those ultimately decrease the function or jeopardize the function of the testicle. Also leads to increase the temperature of the testicle, and I just explained the optimum temperature of the testicle is 3 degrees below the core body temperature. This explains easily the negative impact of varicocele on the semen analysis. First, the varicocele affects the motility of the sperms, and then induces abnormal shapes of the sperms, and then dead sperms. With chronic varicocele, and if the varicocele lasts for a long time, the whole factory is affected, and the factory induces less sperms, and this reflects on the sperm count of the semen analysis. Varicocele is a common disease, affects more than 15% of the young men. It is rare to be seen in a preschool age, and also it is rare to be seen in elderly above 50 years. If there is any risk factor for varicocele, could be. Genetics play a role, yes it could, and this explains why varicocele is common in a group of people than others. So what about the diagnosis? The diagnosis depends on a group of symptoms which are known to varicocele: pain, heaviness in the beginning of varicocele, or swelling in advanced varicocele, or the common manifestation or common symptom which is delay in the conception, infertility, male infertility, problem in the semen analysis. All of those are the symptoms of varicocele. Clinical examination is the mainstay of the diagnosis of varicocele. Clinical examination does not only diagnose varicocele, but determines the degree. There are 3 degrees of varicocele: grade 1, 2, and 3. Grade 1, I can't feel it, but it can be seen on ultrasound only. And grade 2, I feel it. And in grade 3, I can see it and feel it. And if we look to this guy, you see here the varicocele can be seen by eyes, so it is a grade 3 varicocele. Here is a common question. Many patients come to me with a scrotal ultrasound. It shows a grade 1 varicocele, and after I do a physical examination or clinical examination, I couldn't find any varicocele. So the question is, by all patients, why this conflict? There is no conflict. Grade 1 describes by this criteria: if the varicocele is seen only by ultrasound and couldn't be palpated by the physical examination, it's a grade 1. So there is no conflict. Regarding the treatment options, there are 3 treatment options. Surgery is the primary one and the oldest method. And the surgery is a 1-day surgery. It is a simple surgery, 3 or 4 centimeter incision in the inguinal region. 45 minutes, patient can leave the hospital on the same day. So the second one, which is laparoscopy, as you know, laparoscopy has induced a revolution in surgery, really. And if you ask me for the cholecystectomy or taking the gallbladder out or for surgeries of the kidneys, I vote without any hesitation for laparoscopy. However, for varicocelectomy, I don't vote for laparoscopy. First, laparoscopy has a high incidence of recurrence. When I started doing laparoscopic varicocelectomy, I noticed high recurrence rate, so I stopped this procedure. And also, as I mentioned, The varicocelectomy is a simple small incision, so no need for laparoscopy. The third alternative one, which is the injection through the interventional radiology. Look to this diagram. This is the testicle and this is the vein of the testicle. And how do we approach this deep vein? Yes, we can approach through a superficial one. One of the leg veins can be approached, and after injecting a contrast media, mapping the veins, we can approach or we can access the vein of the testicle, and we can inject a certain material to occlude this vein. It is a simple maneuver, yes, local anesthesia, patient can go home quickly, but still I am voting for surgery. Why? Because varicocelectomy is a simple surgery. Although I published 3 articles on the interventional radiology on the kidney, which is marvelous, but still I am voting for surgery as the primary option for varicocelectomy. But this method can be reserved for specific or certain types of patients. I'm going to summarize varicocele scenarios into 3 main scenarios. Scenario number 1, 30-year-old male patient, married 2 years ago. He didn't have any kids, and he came to me to the urology clinic with the ultrasound shows grade 1 varicocele. What is the next step? Nothing. Grade 1 doesn't require any management. I will jump to grade 3. Patient come to me with pain, heaviness, swelling. After clinical examination, I found the grade 3 varicocele. I can see the varicocele by my eyes. Also, the varicocele affected the testicle, and the testicle becomes smaller inside. What is the next step? Surgery. There is no oral medication, no injection for varicocele. So grade 1 doesn't require any treatment. Grade 3 requires surgery without any hesitation. So the discussion always in grade 2. The decision on grade 2 either to proceed or not depends on the fertility. If the varicocele negatively impacts or negatively affects the semen analysis or the fertility issues, we intervene. I'm going to give you scenario 2A. Patient who came to me with mild pain, mild heaviness in the testicle. He has kids, the youngest 1 year, and he doesn't have any fertility issues, and the pain is mild. What is the recommendations? Follow up. And by the way, the follow up for grade 2 does not require periodic frequent visits, but like a visit each year. This is what I recommend. Changes in the varicocele do not appear frequently and require time. So scenario 2B, patient came to me, he has pain, mild pain, heaviness in the testicle, and he has fertility issues. He didn't get any kids for the last of years. And I looked into the semen analysis. There is decreased number, or there is weak sperms, there is dead sperms. What is the recommendation? Surgery. Varicocelectomy is a simple surgery and always recommended before any assisted reproductive techniques. So this patient requires surgery. In conclusion, varicocele is a dilatation tortuosity of the veins of the testicle. Physical examination is the primary method of diagnosis. No need for scrotal ultrasound in all cases. Surgery is the primary treatment. However, injection through sclerotherapy or interventional radiology is a good alternative way in some cases. There are 3 degrees of varicocele. Grade 1 doesn't require any treatment. Grade 3 requires surgery, and the decision on grade 2 depends on the fertility issue. If there is infertility issue of the or of the semen analysis is negatively impacted, we recommend surgery. However, if there is a grade 2 varicocele does not impact the semen analysis, that not associated with the infertility issues, we recommend periodic follow-up every year. This is what I have, and thanks for listening, and I'm going to answer all of your questions on this link. Thank you.